Okay, good morning, everyone. I'm Laura Shaughnessy. I serve as the chair of the Professional Counselor Advisory Committee for the Kansas Behavioral Sciences Regulatory Board. I ask that the members of the advisory committee respond to a roll call to signify their presence at this open meeting. It's being conducted remotely by conference call and other electronic medium. Jim Kilmartin.
Present.
Good morning.
Good
Harriet
morning.
Butler.
I'm here.
Morning.
Good morning.
Michelle Fairbank.
Here.
Good morning.
Morning.
Bob Kircher.
Here.
Morning.
Good morning.
Andrew Secor.
Here.
Good morning, Andrew.
Good morning.
Adil Torres Rivera.
Here.
Good morning. I note the following BSRB staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Anybody else on there? Any other staff?
Just the two of us, and then there are some representatives that will be talking about the multi-state compact today that are in attendance.
David Fye will now read a message concerning the board meeting being held today remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require advisory committees to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. One group of presenters has been approved to speak to the advisory committee for 30 minutes on a multi-state compact for professional counseling. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On July 7th, 2022, we sent notice of the advisory committee meetings to all individuals who had requested notice of advisory committee meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website, and you may request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the members of the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call is active as well. I have not heard any beeps, but if anyone enters the conference call, I will let you know.
Thank you, David. The meeting is now called to order and the advisory committee will begin its discussion of the first item on this agenda. Before we do that, I would like to introduce our new public BSRB board member and advisory committee member, Jim Kilmartin. Jim, would you be willing to say hello and just say a few things about yourself, and welcome?
Thank you. Certainly. My name is Jim Kilmartin. I've lived for 35 years or so in Topeka, and 8 years ago when I retired from Stormont Vale Health, I moved to Shawnee. So currently live in Shawnee, Kansas. I retired from Stormont Vale as the administrative director of quality, patient safety, and risk management. Prior to that, I had served as a director over clinical areas, including diagnostic imaging, neurology, most every service at one point or another, except for pharmacy and nursing units. So I have, prior to coming to this board, I served previously on the Kansas Dental Board for 8 years. And that term expired last April. And as a retiree, I got plenty of time. So I was asked to participate. And since I have plenty of time to give back, I agreed after being asked to join this board, and I'm excited to learn more.
Terrific. Thank you and welcome.
Thank you.
So David, our minutes, approval of minutes, do we want to do minutes and agenda before public comment? Or do we want to do it after?
Either way is fine. So whatever you would prefer, we can go ahead and do. So.
I think we should go ahead with public comment and really hear from the compact folks. So let's go ahead and do that. Do you want to announce that?
Sure. So we have some representatives who are in attendance today. That is Lynn Lindy from the ACA, the American Counseling Association, and also Dan Logston and Carl Sims that are from, I believe, the Council for State Governments, CSG. And they're going to be speaking about a multi-state compact for professional counseling. This professional counseling compact has been in the works for a few years. I believe in the first year that it was proposed to different legislative bodies to consider, two groups adopted the compact, and that was Georgia and Maryland, I believe. And then last year, several more, or this past spring, several more joined. So they're going to be speaking a little bit about what multi-state compacts involve, and then more specifically about this compact for professional counseling. So I think I'll just go ahead and turn it over to them, and then they can provide a presentation to you today.
All right. David, can I share my screen? Is that your?
Yes, I believe you should be able to share your screen.
Okay. So thank you. This is always an adventure. All right. Okay, so hi everyone. As David said, I'm Dan Logston. I'm joined by Carl Sims, CSG, and Lynn Lindy. Council of State Governments is a membership organization for states. Every state's a member, every state pays dues. We're not a lobbying organization or anything like that. We provide technical assistance to the states. We're nonprofit, nonpartisan. And one of the things we've done for our entire history is work on interstate compacts. So these are just binding legal contracts between and among states. Every state belongs to about 25 interstate compacts, obviously some less, some more. States like them because they protect sovereignty. They're versatile tools that states can use to address problems, bilaterally, regionally, and there's, I think, 6 national compacts that every state is a member of. A lot of times, especially recently, Congress will give the states the option of trying to work something out by an interstate compact before they take action. And so, they are a good tool for states to address that, but sometimes some things need a federal solution. But occupational licensure certainly isn't one of them. In the early part of the last decade, the federal government started asking some very pointed questions to the states about occupational licensure, and the states, although there are good answers, they didn't have good answers for them. And there's been a lot of activity, a lot of concern, a lot of questions still. The biggest thing is about mobility and portability. The federal government can't get their head around the fact that I'm licensed in Kansas. Why can't I just take that Kansas license and practice anywhere? It's like, well, there's good reasons for not being able to do that. They're starting to listen to those reasons. They like interstate compacts. The Congress especially thinks these are good tools. The FTC, the Department of Labor, et cetera, and certainly the Department of Defense. So we're making some headway there. But there's still going to be a lot of scrutiny going forward about how states handle occupational licensure, and especially around mobility and portability. So the benefits of these licensure compacts there, you can see that. I mean, they do expand the public protection net. This is one of the few times where the regulator is not left behind. We have these licensure compacts, regardless of the profession, bring the regulator along to deal with this new era of practice where you've got borderless practice or semi-borderless practice for practitioners. The regulator can still regulate that profession and cooperate with other states to do that. Most of these compacts are in the healthcare space, although we're seeing that change. We're working on a number of compacts for for the Department of Defense. Teaching is a part of that, and cosmetology. So those will be the first ones that are completely outside the health or allied health space. And, the reason that healthcare, obviously, healthcare reciprocity is taking hold. We all know during the pandemic, telehealth exploded. It continues to do that. It can address access to care issues, but you're also seeing a more mobile society where, people are changing locations a lot. That's certainly true of practitioners. And so, these professionals who are all licensed, typically regardless of the state, that's where we've really been focused on occupational licensure compacts. So these have been responded to well by states. So we've got over 220 pieces of different licensure compact legislation that's been enacted by the states. 43 states, DC and Guam, are in at least one. 35 states in DC are in 3. And then 15 states have enacted 6 of the 9. Only one state's enacted all 9 of them, but you got a number of states that enacted 7 and 8. Utah has enacted all 9 of the existing ones. Kansas is in the latter category. They've enacted 6 of these licensure compacts. So, with hope, you're hearing a good story from your fellow boards about that. I always encourage when we're talking to boards to, and you've got a number of examples here, reach out to those boards and see how their experience has been. I think you'll hear good news, but, we always like to encourage that. Won't spend much time here, but these are the existing 9 and the number of states that they have. So there's counseling at 16. Delaware has enacted it. We're just waiting for the governor to sign it. Evidently, the governor of Delaware has a very long time to sign legislation. So not sure we'll get them anytime soon. But anyway, it's really, that number is 17 because the legislature has enacted the counseling compact, and we have absolutely no doubts that the governor will sign that legislation. And then these are the ones that we're working on currently. Physicians Associates is not a part, excuse me, of the Department of Defense compacts. We're working on that. We're advising the Federation of State Medical Boards. So they're working on the Physicians Associates compact with the HRSA grant, but the rest of those are part of our Department of Defense cooperative agreement. I can explain more about that later if you like. Okay, so wanted to run through those quickly. Here is the counseling compact. So, if you know anything about these licensure compacts, this is more akin to what PT did, what OT did, what ASLP did. It relies on that compact privilege. It's a mutual recognition type compact. We'll get into that in a few minutes. There's really 2 types. The medical compact is expedited licensure. The rest rely on mutual recognition of a home state license. And again, the 16 states there, that's really 17, but we don't want to count it yet. Here's the map of our disbursements. So the light blue is where we had legislation filed, but the session clock ran out. So looking to file in a number of jurisdictions next year. So definitely Texas will be among those, but we'll publish that information later this year. And because we're at 16 states, the Compact Commission now can become operational. That meeting is scheduled for the end of October. I think that last full week of October. So the commission will meet, it'll start writing rules and bylaws. It'll start the process of standing up the commission in late October. So how does it work? Well, again, you've got, it works just like PT and OT will and the ASLP compact. So the state requirements, so you've got, the state requirements and what the practitioner has to do. So the state requirements, it's only for licensed LPCs, and we define LPC in the document as someone that as part of their license can, Lynn, help me out here, assess, diagnose, and treat. So there was a lot of discussion about could we include different levels of counseling, and compacts thrive on uniformity, and frankly there just wasn't the uniformity that we needed there. So I know there's efforts among AASCB to look at some sort of reciprocity regime there, but this compact will be exclusive to those LPCs. It requires a national exam, supervised postgraduate experience, 60 semester hour master's degree, or 90 quarter hours for a master's degree. And then again, it requires the states to cooperate to investigate complaints and then provide that information to the Compact Commission. And then for the practitioner, so again, because we had uniformity, we got to not get so specific with these. So, your home state has to be a member of the compact. So we get pushed back on this, but what we've heard from boards and legislators over the years is like, and this typically doesn't happen, but if there's an investigation that we have to conduct of a practitioner that lives in another state, we don't want to have to hunt for them. We want to be able to know that yes, they're in Kentucky, or yes, they're in Illinois. And so everything relies on that home state license. So your home state has to join the compact. We give the states an option, or the practitioner will have to have either a social security number or a national practitioner number. Some states are moving away from social security numbers, although, I've been in and around state government for about 22 years, and I've always heard that, there are some states that have taken some steps, but we wanted to at least give states the option. You can't have had any adverse actions within the previous 2 years. Like all these licensure compacts, it requires an FBI fingerprint-based criminal background check. You must adhere to the scope of practice in the state where you're practicing. So if a practitioner is practicing in Kansas, they're subject to your jurisdiction. They don't get to, rely on the fact that their state allows them to do X, Y, or Z. compact's clear. If they're in Kansas, they're under Kansas's jurisdiction. The benefit for practitioners is that they only have to keep up with the continuing ed in the home state. And that's something that's typical of all these licensure compacts. So, here's sort of a visual representation of how it would work. You've got your home state license. Once you've passed the jurisprudence exam, if a state requires it, some states do, they're typically open book. The board just wants to essentially for you to verify that, yes, I understand what I can do here. If you've had the background check and submitted information for that, then, like PT, you can apply, and essentially that application is just designate which compact member states you want to get a privilege in. You get the privilege, and then you can work in those states. The state board would, push all that through the compact commission like PT. So trying to keep a lot of work off the state boards and, on that compact data system, it'll be a process. Right now, PT, if you get all your work done on the front end, they can issue a privilege in about, 15 minutes. I don't think this compact or OT or speech will be there right away, but eventually that's the hope, is that they get there. But again, it'll take longer to get a privilege than 10 minutes. But once you've got the jurisprudence exam box checked, if your license is clean, and if you have submitted information for that background check, then you can at that point get that privileged practice. All right, and then so again, the compact commission, which will be stood up in late October, they administer the compact. This isn't some sort of super regulatory body. They can't take action against the practitioner. They can't dictate policy to states. They only exist to administer the compact, implement the compact. So you hear concerns sometimes from legislators about rulemaking. Yes, the compact has rulemaking authority, but again, it's contained within the four walls of the document. So they can't issue a rule that says all member states have to allow this type of practice, or all member states can't allow this type of practice. That's clearly outside their purview. And then again, the most important thing that the compact commission does is that compact data system that backs up the website where you would get the privileges. All these licensure compacts have robust data systems that back that up. And that's also the data system that the states will use as a part of disciplinary actions if they need cooperation from other states, reporting that up so other states can see it, and then the whole licensure verification. And again, this is modeled after PT. If you wanted more information about that, I'd ask you to talk to the PT board. They're going to give you better information than I will. All right, and then so I mentioned public protection earlier. Again, we didn't leave the regulators behind. When someone's in your state, you have jurisdiction over them. If you need assistance from other jurisdictions, that's part of joining the compact. They're obligated to help you. You're not going to have to go hunt somebody down all over the country. If they're in the compact, their home state of residence is where they're licensed, so they're not going to be able to get a license in one compact member state and get into the compact. That FBI background check is something that's critical. It's also a colossal issue that all the compacts are dealing with right now. So I think we're making some headway there. But again, that would all be processed through the board and then the state agency, which is typically the state police that interfaces with the FBI. We mentioned that the license has to be unrestricted for the previous 2 years. So we've got that 2-year look back. If a practitioner has a license in a non-member state and they get an adverse action, they're required to report that within 30 days. So state boards retain control, of the scope of practice, their initial licensure process. They get access to that data system, and then the compact commission is made up of representatives from the state. It's a government agency, and so each state that passes it, their board will appoint a practitioner, will appoint a board member or a board administrator or a public member to the compact commission. That's who makes the decisions about how the compact operates. But again, all the compact can do is implement, or the commission can do is implement the compact. So again, the compact commission will stand that up in October. Typically takes 12 to 14 months from that time to have the compact be operational. I know some people get frustrated with the amount of time that it takes to actually get these things working, but they're doing a lot. They're providing a means for practitioners to engage in borderless or modified borderless practice. They're protecting the ability of the state boards, and in many ways enhancing the ability of the state boards to regulate if they need to mete out discipline. and then they're protecting state sovereignty. So, these documents do a lot. Once they're in place, though, they can last decades. All right, and then, additional benefits here. All these licensure compacts have robust provisions for military spouses. Military spouses on average move, families move every 3 years. So, we've worked with the Department of Defense extensively on these licensure compacts. They believe in them. They're funding the creation of up to 10 licensure compacts. We're working on 7 currently. And so, but these benefits provided the military spouses predate that cooperative agreement that we entered into with the Department of Defense. All right, and then so there you see the bottom line. We're trying to address, and I think the compact can address, access to care. It's not automatic. Expands market opportunities. You hear from time to time, legislators will pass legislation around, universal licensure. I think 19 states or 17 states have bills like this, where, if you can bring us a license that's clean from another jurisdiction, we'll essentially give you a license. They all work a little bit differently. And they're not the exchange that they're marketed to be. But again, you're not really doing anything for the practitioners in your state if you pass one of those. It's not bad public policy, but the compact allows practitioners in your state to also serve people outside of the state. Facilitates telehealth. This is something, again, Congress and the federal government are very interested in around telehealth. It does promote cooperation among the member states, and we believe, and I think the other compacts would bear this out, it does provide an extra layer of consumer protection, especially in an era where you're going to have practitioners who are operating in other states with the mutual recognition of their home state license. All right, and then I'm the only one listed here, but obviously Carl's on and Lynn's on. So happy to, if we went over something too quickly, take your questions and try to clear some things up or provide you with more information. And I want to stop sharing.
Thank you.
Great.
So we've got about 10 to 15 minutes left in which we can ask questions. And then we will further discuss all the things we've learned and things we'll continue to think about. We'll discuss them at our next advisory committee in October. So does anybody have any questions? And thank you for your presentation, by the way. Thank you.
No, thank you.
I have one question to start. So for public protection agencies like ourselves, we have a composite board, so we oversee 7 different types of professions we license. For some of the professions, as many as 40% of our licenses are from out-of-state practitioners. So I know one of the benefits of the compacts for the licensees is that they don't have to purchase as many licenses from different states. I know some of the other compacts allow states to issue a multi-state license as a way to recoup some of the revenue they are going to lose if people stop purchasing as many licenses. Is there a way under the compact for states to recoup some of the lost revenue from people who want to practice under the compact?
Yeah, and that was the main reason that the project team went with this privilege model. So the states can charge a fee for that compact privilege that's issued for their states, and they get to set that fee. So that's how PT worked. That was one of the reasons that, when the physical therapists, it's my understanding, were developing their compact, the boards have a lot of concern about, well, are we going to lose revenue because we have to exist off our revenue? And, they created this privilege model where, yes, you're going to lose that license fee potentially. It won't be automatically overnight, but I think over time, people will migrate to the privilege. You get to charge a fee for that privilege. So, yeah, and the state gets to set that fee. There will also be a fee at the compact commission level.
Okay, so would there be like a normal license and then they could purchase the privilege to practice? Would that be something the state would issue? Is that what you said?
Yeah, it'll, the vision is it would work like PT. So essentially the state would authorize the compact commission to issue those based on, the list that they upload to the commission of practitioners who are eligible. So, if you're on the good list, the compact commission will have that information. And when you go to purchase a privilege, you'll be able to. If you're not on that good list, then you won't be able to purchase the compact privilege.
Okay, under the professions for our agency, I think the one that we have become a member of so far has been the SIPAC Commission,
Mhm.
and that one has sort of a limited scope. Under the SIPAC Commission, individuals can apply to the commission to do either just teletherapy or they can do a limited number of days of in-state practice.
Mhm.
For the professional counseling one, it sounds like if you are practicing under the compact, there's not a limit to what type of services you can do. Is that correct?
Yes, that's, we work with SIPAC as well. Yeah, it's a telehealth, telemedicine, telepsychology compact. And it's got provisions if you need to go to a state, if you've got a client in crisis or there's an emergency, yeah, you've got a limited time to do that. Yeah, with the counseling compact, you could practice full-time in other compact member states, either via telehealth or in person.
Yeah, one of the other differences with the SIPAC is counseling has always said that a counselor must be licensed where the client is located.
Hmm.
So wherever that client is located, the counselor must be licensed in order to work with that client. That's not true with psychology. SIPAC has defined location as where the psychologist is located, regardless of where the client is located. So that's a difference as well.
Yeah.
The counseling compact also shuts down some of that stuff that was going on during, or will shut down some of that stuff that was going on with the pandemic, with people saying, well, I'm not licensed in this state, so I'm just going to call myself a coach and continue to work with clients in other states, but I'm not counseling, I'm coaching. So under the compact, that would be almost impossible to do.
And those are great points, Lynn. And just also, I mean, as a colleague of mine always says, and I always forget to mention, I mean, this is voluntary. It's creating another pathway. If you wanted to get a full license in another compact member state, you could do that. And if you're licensed in another compact member state, it's not like your license goes away.
As part of the compact, are only independently licensed counselors allowed to be part of that? We have tiered licensure.
Yeah.
So our LPC doesn't require post-grad work.
Only people who are licensed to practice independently
Yes.
and who have the ability to assess, diagnose, and treat behavioral health conditions. So nobody who's working on licensure hours, nobody who needs supervision. It is only people who can work independently. We chose the term LPC. Some of you have been around long enough to remember the 2020 Commission, and that was supposed to be the agreed upon term that we were all going to use. And it turned out when we looked across the states that there were about 22 terms that everybody was using. But the group did decide for the ease of convenience to choose LPC. So it's not what the initials are in the license in the bill that's important. It's what that person can do. So you have to read the definition.
Thank you.
Thank you. The compact counseling, Carl, can you help me with the website address? I got about 15. Okay, yeah, counselingcompact.org is the project website. So you can keep track of the map, obviously, but it's got a toolkit. It's got frequently asked questions, and information now about the Compact Commission. So, if you want to see more information, we encourage you to check that out.
I do have one other question. I realize the first full meeting is going to be, it sounds like in October this year. And so some of these things are probably to be determined, but has there been any discussion so far in terms of the cost to each state to be a member of the compact?
No, currently only nursing and SIPAC have assessments on the member states. The other compacts rely on contributions from outside organizations or they're funded through federal grants. I can't speak for the commission, but I'm confident that, assessing the states for operation will be a last resort. And the other compact commissions have found ways around that. Nothing is guaranteed, but, I've talked to HRSA a lot because I'm trying to work them for money. And, they are very interested in telehealth, especially around behavioral health professions. They see it as a way to address, the spike in substance use disorders the fentanyl issues, issues that you're seeing, especially in the Midwest around, again, substance use disorders. So I think, and again, nothing's guaranteed, but I think there's going to be opportunities for, SIPAC already has a HRSA grant, but social work and counseling to get grants that other professions just aren't going to be able to because they don't operate in that mental health space.
A couple other points about the compact. It facilitates counseling across states, but it doesn't require it. So anybody who wants to practice in any particular state always has the option of going directly for a license. And anybody who currently holds a license in those states is welcome to continue to hold those licenses. But it does provide continuity of care because we know that counselors are mobile. We know that clients are extremely mobile. And so it does offer those options. It also offers an option for an expedited license when someone moves and their home state changes. So if you have a counselor in Kansas who moves to Kentucky, for example, they would have the option, if Kansas were a compact state, to get a Kentucky license without having to start from scratch. There would be a special process for people who hold licenses in other compact states. So it provides benefits for the clients, all of the people who live in the state of Kansas, as well as for counselors.
If there's any advisory committee members that have questions, feel free to jump in. I always have lots of questions. I was recently sat in on a conversation about the social work compact that's in draft form right now. And there was a conversation about the fingerprint requirement. And so we don't currently require fingerprints as part of a background check for all applicants. So I just want to understand how that would work if we became a member of the compact in terms of that fingerprint requirement.
Yeah. The physical therapy compact requires that when states join, they have to implement an FBI fingerprint-based criminal background check at initial licensure. The project team felt as though they didn't want that requirement for everyone. Some people may not have any intention of using the compact. So that happens at the point where you decide you want to use the compact. So it'll be a little clunky for the boards, but again, they won't have to implement it for every practitioner. So there'll be a process, and the commission will advise the states on this based on best practices from the other states. But there'll be a process where I will somehow contact the state board and start the process to submit my information to the state police or whichever agency in Kansas does this, to get the FBI fingerprint-based criminal background check. The board will receive that information. There's other elements as to whether or not I'm eligible, but if the board didn't see anything on that background check that gave them pause that I could practice in other states under the compact, my license was clean. It looks as though I checked the box on the jurisprudence exam, then they would put me on that good list, and I could go to the compact commission and get a privilege. So we're still, we'll have to work that out because again, this one's different. OT went that route as well as the speech pathologist and audiologist. They just, the project teams didn't want to require that. And that was mostly from feedback from the boards. They didn't want to implement that for all the practitioners. They wanted to keep it specific to folks that wanted to use the compact.
And I always feel compelled to mention that the advisory committee, which came up with the requirements for the legislation, were comprised of board members and counselors. The drafting team that wrote the actual legislation were all basically board members, board administrators, attorneys for licensing boards, executive directors of boards, and a handful of a couple of other people. Mary Alice Olson, who was the former executive director of AASCB, Ryan Pickett was representing AASCB. So people who were extremely knowledgeable about counseling licensure regulations. So it was written by your colleagues. So it wasn't a bunch of outsiders deciding what should happen to licenses. And just to reiterate what Dan said, it doesn't impact, the compact does not impact initial licensure for any state. You continue to license people the way you always did, or however your law requires. It only impacts those who want to practice across state lines.
This is Andrew. In terms of the added work, it sounds like the process of approving the privilege is the commission's responsibility and not the regulatory board, or how does that work? I'm just thinking about
Yeah.
how work changes.
No, that's a great question, and I'm sorry for the confusion. It's up to the boards to decide who in their state is eligible based on all the criteria. The way PT works is, that information is sent up to the commission website, and if I want to get a privilege, if I'm on those lists, it'll process a privilege for me. And if the board has decided that no, I don't meet these criterias, or it's very, I've got an adverse action recently, or there was something in the background check that gave them a little pause, then I wouldn't be on that list. So the state's, not going to be issuing the privilege. That's the vision for this, but they will determine licensees in their states that are eligible.
So the state board would provide a registry of people who are independently licensed that have had an unrestricted license for at least the last 2 years, and such, send down up to the commission board. And then at that point, if a person would apply for a privilege to practice in Kansas, so long as the state of Kansas had placed that person on the list of eligible people, then the commission would grant the privilege. So the work the state takes on is just taking who's eligible and keeping that list current for the commission, and the commission board does the rest of that.
Yeah, and there shouldn't be, most of that's handled by the data system. The commission or the state will also have to report up any sort of disciplinary information. The commission will write rules about what exactly that takes. But, the whole point of this is protect the public. And so if Kentucky's put me on the list that I'm eligible and I'm in Kansas, and the Kansas board is taking action against me, the other states need to be aware that something's happening. Then, it's really up to Kansas to decide whether or not, I get to continue to work there if I'm violating their code of conduct or their practice act. So, you don't, just because I have a compact privilege, we're not creating a special class of practitioners. You can take action against me in the same manner you can take action against someone you issued a license to.
The thing about that is helpful is that there are folks that will leave a state, go to another state, get a license. And because the states don't talk and people aren't necessarily always honest, or maybe they don't have to say anything because no formal action has been completed, they get a license elsewhere while there's pending action being done somewhere else. And so that could potentially, in talking about public protection, be a way of limiting how many people are able to go elsewhere and potentially be harmed while another state is looking into their situation. I also just want to make sure that we know how much extra work, because I know our board is a limited number of personnel. And I know that's something to be mindful of, is what added workload would be placed on them to accomplish this, so they can assess their willingness or abilities to follow through with something should and likely will legislation be proposed here. So.
Thank you. Lynn, did you want to say something?
Oh, I was going to say everything is tied to the home state license. So if someone is licensed in another state and you grant a privilege, the privilege is effective or ends at the same time they need to renew their home state license to ensure that nobody is practicing in your state, or none of your counselors is practicing in another state on an expired license. So if somebody gets 10 privileges, I can't imagine why, but if that's what they wanted to do, all 10 privileges are going to have the same start and end date. So that's another safeguard to protect the public. And remember, every board that participates names a member of your current licensing board to be a commissioner. So it is your colleagues who are going to be running the commission. And I'm sure that they are all acutely aware of writing any rules or bylaws that are going to be either overly prescriptive or provide too much work for any individual board.
So thank you. And just my last question, so we're wrapping up. I tend to have a lot of questions as well, as people know, but so each state will have a commissioner from their state. So there could be possibly, if all 50 states enacted, there'd be 50 commissioners. Would that kind of what you're saying? That would be overlooking this?
Yes.
So there's representation from each state on this. Okay. All right. Thank you.
And territories, because living next to DC, I'm always acutely aware that we don't want to leave out DC, Puerto Rico, or any of the other. Adil would have words with me later about that, and or any of the other territories. So, and we fully expect that some of the territories will be looking at this next year, and DC is, as a political entity, is already planning on introducing legislation for next year.
Yeah, the compact defines state as, it includes territories. It just, to say state and territories throughout the document would be a nightmare. So we define state as including territories.
Thank you.
Okay, does anybody else have any questions? Okay, thank you so much for your presentation and your time, and for taking the time to answer our questions. And clearly we will be discussing everything we've learned and everything we're thinking about at our next advisory committee.
All
So
right.
thank you again for your time. David, do you have any other wrap-up comments or questions?
No, but I appreciate you all visiting with us today and sharing the information. We're going to go for another hour and 15 minutes or so, so feel free to drop off the call and we'll just follow up with you if we have additional questions.
Yes, David, you know how to get us, so happy to answer any questions that come up.
Great. Thank you again.
Thank you all.
Thank you. Okay. Got a bad cough today, so if you see me, if I stop talking and you see me hit my mute button, I'm trying to be respectful of your ears. Okay, so let's move on. I'm really looking forward to discussing this in the future. There were so many great questions raised, and I know we probably all learned a great deal, and everyone received the slides, correct? Okay, thank you. Thanks for sending those out, David.
And their presentation today, I think, was slightly different than the packet that was sent out before, but they modified it. They said they put in a Kansas specific slide and adjusted a couple things. So
yeah.
Laura, could I just briefly mention any voting that anything you might do in this? I will have to abstain in this one because I, being president of the Counseling Association and legislative person that's kind of looking at this, would be the one proposing this to the state, and likely working with representatives to see what move this forward. So I would have to limit my role based on our legal training and such that we talked through, so as not to put myself in a position to be in conflict with that role.
Certainly. Thank you for mentioning that.
That being the case, I have to be in the same situation because I'm the president-elect of the ACA, and I was a governor council person who approved using the ACA saving to push the compact. So I'm very invested because I also spent 12 years in the Army. So so if Andrew's ineligible, then I'm double ineligible to vote.
Well, and again, thank you for bringing that up, and both of you naming ethically your limit to participating in the vote. It does not, however, keep you from participating and asking great questions, which you're doing. So thank you so much for bringing up ideas and asking questions, and that will help us when we come to the vote. So thank you. Anything else about that before we move on? Okay, so let's go ahead and do minutes and the agenda. So first of all, you have received, of course, the agenda. Does anybody have any questions about the agenda or need to make any additions or changes? Okay, then I would like a motion, please, to approve the agenda.
I move.
Okay, Adil makes the motion. I need a second.
Second.
Thank you, Andrew. Anybody, all in favor, say aye.
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 No opposed? Okay, then the agenda passes. Okay, let's go on to the minutes from the last meeting. You received minutes. Thank you, David, for sending those out. Does anybody have any questions or changes for the minutes from the last meeting?
On 4C,
Uh-huh.
it's really supposed to be the National Board for Certified Counselors rather than of certified counselors. It's just a technical thing, but it is the official title is of is not the official title, it's for.
Yeah. Thank you for that. Those
And
details.
and then on, let's see, 6B, I assume that on the paragraph, it should say language that the activities rather than actives.
Okay. Thank you for catching that.
And those are the only two things that I've caught.
Thank you for that. Okay, anyone else? No? So I need a motion to approve the minutes from our last meeting.
I move that we approve the minutes from the last meeting with the changes
Thank you.
discussed.
Need a second for that?
I'll second it.
Thank you. So Michelle's seconding it, and then all in favor say aye.
Aye.
No
Aye.
opposed? Any opposed? Okay, it passes. Thank you so much. Okay, Executive Director's Report, David Fye.
Thank you, Laura. So one quick advisory committee update. I did receive an email from Jessica Allison over the weekend. She said, unfortunately, because of some other things going on, she's going to have to resign from the advisory committee, which also means that she will be resigning from the subcommittee of the advisory committee. So we wish her well and thank her for her service on the advisory committee. But that does drop the members down to, I believe, 5 non-board members on the advisory committee currently. As far as some BSRB updates, we are still under the governor's direction related to the pandemic. So we are avoiding most in-person meetings. So we'll continue to have most board meetings and advisory committees over Zoom and continuing to monitor the situation and making sure we're keeping everyone safe. Additionally, we do have a new employee with the BSRB since the last time we spoke. Emma Allen is serving as our new licensing specialist. She is going to be a part-time employee while she's going to Washburn in the fall. And she is helping us out currently with some of our renewals, and we're going to cross-train her in other areas of the office to make sure that we don't have delays in one specific area when we have a busy time, and also so that people are able to take vacations, and if someone is out of the office because of illness or another reason, she's going to be sort of our specialist who can float and make sure that we keep things moving. So really happy to have her on board, excited to work with her, and I think if you get the opportunity to meet her, I think you'll be really impressed with her as well. Some updates from the board meeting on July 11th, 2022. Every July meeting for the board by statute, there is a new election for board chair and vice chair. So the new chair of the board is Mary Jones, who represents the marriage and family therapy profession. The vice chair for the board continues to be Dave Anderson, who serves as a board member for master's level psychology. Additionally, there are 3 new members of the board. Cynthia Schindel has been named by the governor to the board for social work. She has a spot previously occupied by Carolyn Safran. Richard Nobles is a new board member for licensed psychology, and the spot previously held by Bruce Nystrom. And then Jim Kilmartin, who you met earlier today. He has a spot that was previously held as a public member. Previously, Leslie Seawester was in that spot. So excited to have 3 new board members, and we've got them right in, attending lots of meetings as far as advisory committee meetings and hearings and other things before the board. So really happy that they're volunteering their time and serving on the board. The board, in terms of some other activities that they've been working on right now, there's an investigation policy. The members of the board that oversee complaints and investigations are part of the group called the Complaint Review Committee, or the CRC. There's a document called the Investigation Policy for the board, and that has been in the process of being revised. And so the last board meeting, they went through about half of the proposed changes for that document, and it's expected that they will complete the remaining changes at the next board meeting on July 12th, or September 12th. Additionally, every year, the board tries to have an all-day planning meeting. It's usually an off-site meeting where the board members come together and have a full day where they plan out items that have been discussed during the year. Sometimes they submit proposed items to be put into a draft bill before the legislature. The board did select a day for that. That board's all-day planning meeting is going to be on Monday, October 24th in Olathe. This does mean that the advisory committee will have one more meeting before that date. And so any recommendations could be forwarded to the board from today's meeting, but you will also be meeting the first week of October, so you can have any more recommendations to be forwarded to the board from that meeting as well. One more item I wanted to highlight for you. I'm going to be attending an upcoming conference. It's a summit put on by the National Board for Certified Counselors, the NBCC, and I have been asked to present at that conference. I'll be talking to the attendees on innovations in licensing, and looking forward and back is what my presentation is going to be focused on. And without giving too much away, one of the things when people talk about innovations in licensing, most people tend to think of things like technology, or they think about reevaluating our current license requirements and considering removing some of those that some people would call barriers to entry. And other things people talk about are things like the multi-state compact that was discussed earlier today, creating new license types, but everyone seems to be focusing on the front end of that equation in people that are coming new to the profession. And one of the things that I'll be talking about as part of my presentation will be looking at the other individuals involved in the licensure equation. For example, people that are currently licensed that are coming up for renewal, and also people who were previously licensed, and seeing if there's a way that we can invite those individuals back to the licensing profession. One of the items that's on your agenda later on today is a regulation the licensed psychology profession has, and that profession has some special language that if an individual is coming up to their deadline and they have not completed all their continuing education hours, they can request additional time to complete those hours. They still have to renew their license, but this allows them to renew the license and then complete the hours. Normally, they wouldn't be able to do it in that method because when you renew, you have to attest that you have met all the requirements, including finished all of your hours. But for the licensed psychology profession, they have a regulation that allows individuals to stay licensed while completing those. And especially right now during the pandemic, there are certain reasons why individuals might not be able to complete those hours. And so when the licensed psychologist came up for renewal, they all come up in June of even numbered years. We were able to use that regulation aggressively and reach out to individuals who were coming up to the deadline and hadn't renewed. We were able to assist about 10 more licensees to stay licensed and continue to provide services. So I wanted to include that on the agenda for you all to have a discussion about and consider if you think that would be helpful for the professional counseling profession as well. Additionally, one thing that I'll be talking about as part of that presentation is looking at the individuals who had previously been licensed and for one reason or another let their license lapse, either because they decided to take some time away to start a family, or because of illness or illness of someone that was close to them, or perhaps maybe that they were burned out. It's a difficult job under many of the professions. And so is there a way that we can look at those individuals and invite them back, or maybe incentivize them to come back to the profession? One thing that I would be looking at proposing to the board sometime in the future are some creative ways that we can welcome professionals back to the profession, potentially looking at the reinstatement fee. When individuals have let their license lapse, for them to come back, there's often the license fee plus an additional penalty or a fee of that same amount, which I think is to incentivize people not letting their license lapse. But once they have done that and they're on the other side of that, it makes it that much more difficult for them to come back. And so I think looking at that creatively and maybe offering a temporary regulation where we can say, you know, for a 6-month time period, we want to reach out to individuals and say, we would like you to consider coming back. And if we can look at that, one of the benefits of looking at that from that perspective is that if you make all the changes on the front end for new individuals joining the profession, that process to evaluate their education, their references, their experience, it takes a lot of time. Whereas individuals who are coming back, they've already met those requirements at some point. And so the time to bring them back into the profession would be a lot shorter. Even though you would lose a little bit of revenue from decreasing that reinstatement fee, if those individuals aren't licensed, you wouldn't be collecting that revenue at all. And so I think building the base, creates less demand in terms of individuals in the workplace. And even if those individuals only come back for a limited number of years, I think it's a nice way to regrow the profession in a responsible way. So just wanted to kind of touch upon a few of those points that I'll be talking to the attendees at the meeting about, and some of those ideas that I'll be proposing for the board coming up for the board meeting in September and also the meeting in October. So with that, I'll go ahead and end my report and stand for any questions.
Thank you, David. Any questions for David? No? Okay. Okay, we'll move on to old business. So we have 3 items under old business. The first one is an ongoing discussion of pre-approval for continuing education providers and programs. David sent social work language so that we could look at it and use it to compare and see if we, wanted to let it inform what we would recommend. So just, I'd like to invite the discussion. Do we want to recommend or not recommend? Any ideas or feedback? Well, then are we ready to agree on it? Are we going to do it or not? Is it time to vote? David, do you have anything you want to add?
Just as a quick summary, I know some of you may not have thought about this for, it's been a couple months since the last advisory committee meeting, but currently right now, the social work profession is the only profession that has this in regulation to allow continuing education pre-approved providers or pre-approval of a specific continuing education program. And that is largely because that profession had requested this for some of their practitioners in the past. And so, but recently the board asked the advisory committees to discuss if this is something that you'd like to allow for your profession. And there's been good discussion by all the advisory committees on this, on both sides of it. Currently right now, the marriage and family therapy profession is in favor of moving forward with it. The master's level psychology profession is in favor of moving forward with it. But the other professions, I believe, are either still discussing it or they have decided not to move forward with it. So, but yeah, we've kind of had a lengthy conversation on it. I believe at the last advisory committee meeting, we talked about some of the issues involved. So if you would like to make a recommendation on that today, we can go ahead and submit that for the board for consideration. If you would not like to make a recommendation, that is fine too. Nothing would change, but it is something to be proposed for the advisory committee.
Thank you. So any feedback or questions before we put it to a vote?
If I remember correctly, I think there was most of the discussion went around favorably. I think if I remember correctly, I could be completely wrong, but I'm kind of that tendency to move toward that direction because we all need continuing education. Having some agencies pre-approved are actually a good deed for me.
Yeah. Terrific. Thank you. Anybody else want to comment?
Question that I would have is who creates this list and when would it be created? Assuming that this all gets done.
And Bob, do you mean a list of continuing education providers, a list of
yes
providers? Leslie might be able to answer this one. We currently do that for the social work when they apply. So Leslie, do you want to handle that question?
So we cannot put the list on the website, but it can be requested. And the list is created as people are added. We would just do a new query and pull up the most recent information.
So would there be a formal application process for that to be approved?
Yes, we have an application they would have to submit and show they meet all the requirements in the regulation. And then once that's done, then they would be listed on the approved provider or single program. And they'll get a number so that they can say they're approved by BSRB and this is their number.
How many does the social work, how many social worker, or what am I asking? How many programs are on the social work list currently?
Do you know that, Dave? I'm not sure.
I'm not sure either.
If you hold on, I can call Misty and ask.
That's okay. It's just a curiosity. And do you get a lot of people calling and asking for referrals for approved providers for them? Okay.
I kind of look at this as a previous conversation we just had. It's an option people have if they want to go through the rigor, I guess, of becoming an approved provider. But it won't change the fact that people have to become approved providers to do this work, to do trainings. And so it doesn't hurt to have the option there for people that want to go through it, kind of like NBCC. You provide continuing ed, you want to be able to provide for NBCC stuff, you can go through that route and become an NBCC provider. You don't have to do continuing ed. So I'd say if we want to give people the option, if you want to do it, it's fine. If you all have a process in place for already doing it, for getting that set up, that's okay too. And it's not a requirement. So it's just an extra thing people can do if they'd like to.
I have a question about I'm sorry, maybe you weren't finished.
Oh, I'm done.
I had a question about on item 7 on this. There's a 3-year period of approved provider status. So how was that period of time decided? And is that a period of time that we would want to stay with? Would we want it shorter, longer?
So first we start out with a year. The pre-approved provider gets approved for 1 year. And then when it comes time to renew, if everything has gone okay and they show that they still meet requirements, then they renew for the 3 years. And that obviously can be changed if you guys aren't comfortable with 3 years.
Well, a
But
lot
that's
can
what-
happen, you change in 3 years. So I was just wondering about that length of time.
Right. They're required to tell us if something changes that would change their approval.
Is there an audit process? I can see where item 8 says the providers can be evaluated and monitored, but is there a setup audit process that's either done by the board or committee, or do you just go by word of mouth?
We just go by the renewals. We don't have them submit every program that they have put on, but we do have them renew and send us information on some of the programs. And we don't have a formal audit process yet, but I imagine if we're going to have more professions doing this, we'll need one, because it won't be as easy to monitor just one profession.
Yeah.
Harry, does that answer your question about the time frame? Does that make you feel a little more understanding of how?
Right. I think the 1 year approval and then going for 3 year. I guess it was said that it's up to the sponsoring of the continuing ed to let us know if there's any changes, but then again, that may not happen. So I guess to me, 3 years just sounds like a long period of time. And how can we encourage that, letting us know that there's been some changes to their status? That's my question.
Is that a question of, is it enforceable if they don't? They don't inform? Do we lead with that trust of they will inform, or they, something might happen if they don't inform? Is that your concern?
My concern is that regardless of whether they inform or not, there's still many things that change over a 3-year period of time. And do we have some way of actually monitoring that rather than leaving it to them to voluntarily inform? I mean, is there like a questionnaire that's sent out every couple of years, or, how do we know? So.
No, there is not a questionnaire that's sent out until it's time for them to renew.
For the 3-year renewal.
Mhm.
Any other feedback about that time frame?
I was just thinking that as a consumer, There may be some, I mean, a complaint maybe, but you wouldn't know about it until maybe 2 years when they renew their continuing education. I don't know if that's maybe what Harriet was referring to as well. I don't know. From the consumer, from the professional counselor side of that, rather than the provider.
If someone complained to the board office, then it would be investigated and dealt with then, not when they renew.
But I'm wondering, the way it is right now, we had nothing, right?
Huh?
The way we have right now, we don't have, we don't have this pre-approved.
Right, that's correct.
People can do whatever they want to do, regardless, right? So I think that sometimes having something is a little bit better than having nothing. And we can always revisit and do, whatever, because ideas continue to help people to meet the standards and continue to practice.
Prove on it.
Yeah. And so I just thinking that, okay, so what we have right now is nothing, so at least having something is better for me than have nothing.
Point well taken.
I guess my concern is hopefully we'll look at an audit process. My concern is if there's participants, your professional colleagues that go to a meeting that they believe is subpar, that they know they can report it to the BSRB, because this is potentially a money-making operation for somebody, and we can't lose sight of the financial end game. I've been involved in many of these. I like the concept. I think it's good. But I will also say that many of them that I've attended are free. That's rare. I mean, everybody charges something to produce a piece of paper now, even though it's an electronic PDF that you have to fill your own name out in. But as long as there's a process, and I'm concerned about, the only language that concerns me is it says status can be withdrawn if you don't meet the regulation, and the regulations are so vague. I would just point out that how would you ever prove that they didn't meet the regulation? So, but well, that said, I like the concept. I support the concept.
Yeah. So outside of a complaint, that you wouldn't necessarily know.
Yeah, and if they're going to a program outside and just in the interest of getting CEs, hopefully they'll know enough to complain to us. But if they just complain to the CE provider, where's it going to go?
Right.
So.
Leslie, what Jim is bringing up, have you seen a similar circumstance like that from the social work folks? Has anything like this come up where somebody was really complaining about the program and they complained directly to the board? And
Yes, there was something with one of the people who were providing social work safety training, and the board took away the pre-approved provider status from that person.
would it be
But-
appropriate? Oh, go ahead.
Oh, I was going to say, and then the reason that we heard about that were licensees were calling the board and complaining.
Okay. Is there any kind of disclaimer when you give out that list to the social work folks that, when you give it out to somebody who calls and requests it, if you have any questions or concerns, please contact, staff at the BSRB? Are they notified that that would be an important thing to do?
No, but we could do that.
I like that idea. It just reiterates that, we're here to protect the public. And in this case, the public would be our licensees getting their CEUs. So I like the idea of adding that.
I think that would be good.
Just a little reminder. So any other feedback, questions, concerns? Do we have enough people here to vote, David?
Yes.
Okay. So shall we go ahead and take a vote to make a recommendation or to not make a recommendation?
with the added comment that you suggested, that is the disclaimer,
Mhm.
I will move to make a recommendation with the disclaimer that Leslie just mentioned. I mean, you just mentioned. Okay, sorry.
No, it's okay. No, Leslie has to do all the work, so she deserves the credit ahead of time. Okay, so we have a motion to go ahead and make a recommendation to allow pre-approved continuing education providers and programs. We need a second.
I second it.
Okay, thank you so much. So Michelle seconds, and then all in favor, say aye.
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 And any opposed, say nay. Okay, the motion passes. So we will make that recommendation. Thank you so much. You guys make it so easy. I love the discussion. I love to hear the ideas, and then it's just, thank you so much for participating and making this happen. Okay, we can move on. Discussion on the KCREB standards draft 3. David sent out draft 3. And this is, again, just an ongoing discussion so that we can stay familiar with what KCREB is up to. Does anybody have any questions or feedback about the new draft?
I do.
Hmm.
I noticed, and maybe I didn't read this closely enough, it's saying that programs will have students declare a particular emphasis area. And then it listed these different emphasis areas like addictions and family therapy and rehab counseling and so on. So did that mean that a KCREB program would need to offer opportunities for students to specialize in any of these areas? I mean, it seems like that would be a lot for the program to take on. I wasn't real clear on that.
That was my understanding. And that a program doesn't have to offer each one of those specialties. That was my understanding.
Okay. That would be a lot.
That would be a lot.
They have different tracks. So a person could go to clinical counseling or a marriage and family therapy track. So that would be more focused on their area of expertise.
Yes, I get that. But what I'm wondering is, does a program have to offer opportunities for each one of those?
Oh,
I don't-
for all of them.
Yeah. I don't think so. I just helped on an advisory board when Fort Hays was becoming KCREB certified, and they don't have to offer all of them. They can, and we have to have some of them. And it's quite a process that the university had to go through to get KCREB certified. We jumped through a lot of hoops.
Yeah.
But I don't think that we have like all of those tracks. We have a few of them, and then we're also encouraged to continue to develop our curriculums to cover those.
Yeah, because you can, because you also have, you get into the financial piece. You have to
Yes.
have at least so many faculty per program, So what most people do is just concentrate on one or two that they have the faculty for. So they just have to list all of them, but they're not required to have it all.
What I've noticed in this is that it seems a little bit more prescriptive even than previous versions. Really spells out specific details, which were generically referred to in the past, which in some ways is good, and in some ways will be much more difficult to attain and maintain that accreditation.
I think the KCREB is competing now because ANCA just talking about accreditation, school counseling programs. Counseling psychology. Actually, they have the masters now. They can be. So KCREB is trying to be as detailed and specific as possible because it's competing with a lot of other agencies that didn't happen before. So I think that as we move forward, that's what they're dealing with, and that's what we're dealing with at one of our programs to get accredited. You know, need more work for us, and we pay them. You know, so.
Yeah. So any other questions or feedback, well, when we get to C, you'll see why, I'm asking for that again, because our work is, we have some recommendations that we're going to talk about for requirements for licensure, but, anything else you want to discuss before we move on to that about draft 3? Okay, so David, if we, draft 4 probably, I assume there'll be a draft 4. Draft 4 probably won't come out for a while because draft 3 is fairly new, but if you get anything, will you forward it?
Sure, I'd be happy to do that.
Okay, great. Thank you so much. Okay, we'll move on then. The third piece of old business, ongoing discussion about education requirements for licensure. And we have 3 we really want to focus on and arrive at some recommendations about these 3. David, do you want to do any framing of that before we discuss them?
Sure. So most of the conversation last time involved KAR 102-3-3A. And based on the conversation the advisory committee had last time, it was requested if individuals could see the previous version of that regulation. And so I reached out to some representatives from the state library, and they were happy to help me out with that. And so in your packet of material, you should see previous versions of that regulation, one from the 1998 supplement, one from 2000, I believe it was 2003, but it's in the depository from January of 04. And then there's another one from later in 04, the 04 supplement. And then there's a version that was in the regs from 2006. So those are the previous versions of that regulation. The 3 main topics that were discussed last time for consideration of possible changes. One was the in-residence requirement. Currently, right now, when an individual applies for licensure, we look to see did that individual attend a program that is accredited by the national accrediting body for professional counseling. That would be KCREP. If they didn't attend KCREP, we have to look to see did the individual's education and did their program meet the requirements for licensure. And as one of the requirements we look to see in regulation, it identifies that a certain amount of coursework must be attained in residence. And that definition of in residence indicates that that had to be physically present at the school. And so the big discussion point really was whether that requirement that some of the education has to be physically there at the school, whether that is still necessary for the board's public protection mission, or whether that's something that the advisory committee could examine to possibly recommend removing. There is still language as far as it being in face-to-face contact. That could be done by a screen instead of physically present. There's some information about being in front of core faculty, and it was discussed last time that involving the topic of core faculty, some of the KCREP requirements do talk about a ratio of core faculty members to non-core faculty members. So that was a second item that was up for discussion. Do you want to keep this requirement about a certain number of hours being in front of core faculty? But it was mentioned that is connected to some of the KCREP requirements. And then the third item that was discussed was currently right now we require the chair of certain programs to have a counseling degree. And the question was, do you still need that in place for the chair or the individual directing those programs to have that type of degree? The main discussion point I think that was talked about last time involved the in-residence physical requirement, but all 3 were discussed. And so I'm happy to continue that conversation. As I mentioned earlier, if you have any recommendations on things you'd like to propose to be changed, you can make a recommendation that could be forwarded to the board. Additionally, the advisory committee will meet again in October before the board's all-day planning meeting. So you have one more opportunity to do that at your next meeting. But if you're ready to make a recommendation today and you'd like to, we can definitely keep that in the record. So.
Terrific. Thank you, David. Okay, so we've really got 3 things to discuss. can we start with keeping the chair position, someone who has a counseling degree? Can we start with that one, discussing that one and maybe agreeing or, changing that?
It has to be a doctorate in counseling.
Right.
I kind of like that. Being in a counselor educator program, and let's face it, they've been poor disclosure. And graduated in 1995, my degree is counseling psychology, but I never identified as a counselor psychology. I identified as a counselor educator. And at that time, there was only 5 programs in the nation who get degrees, PhDs in counselor education. Right now, everybody that I know, every state had 3 or 4 PhD in counselor ed. And so no open that door for a counselor shooting ourselves in the foot, because what we're saying is, anybody can do our job, but no everybody can do their job. So I think that for me, that requirement it makes sense.
Yeah. Thank you.
I think that the requirement definitely should be someone with a degree in counseling. Whether it's a master's or doctoral degree, I'm not sure at that point matters. But I think that the degree in counseling is key still.
Yeah. Thank you. Anyone else?
Bob, I also believe that if you in a listen research one university, you must have to have a PhD. I mean, you cannot, the only time that you can supervise people is when you're doing internship. So a master person can supervise you. But so I guess that's what they mentioned the PhD, because you're gonna be supervising people beyond about the internship. At least that's my understanding. So that's I could be wrong, but that's my understanding.
Right.
I do have a school's questionnaire, and the person has a master's degree in counseling. Excuse me. And I don't know how many hours into his doctoral degree, but he doesn't have his doctorate yet. So the person's not going to be able to get licensed in Kansas.
One of the issues could be too that they have I think originally it was designed to have a master's at least in counseling, and it's become truly a doctorate in counseling. I don't know. Sometimes master's degree people, I think it's key to have some degree that's in counseling, whether it's a master's or the doctorate. One of the things that's an issue sometimes is a student may be getting a PhD in the higher education realm, so that they can be a supervisor of and take those kinds of positions. I don't know. Just a thought I had.
I remember the old days when they used to, because a master in counseling is a terminal degree. That you didn't have to have anything else. But I think I just go back to the whole idea of how we've been an issue that the market for counselor educator has become so great, even more better than counselor psychologists, in the last 5-8 years. So I think that the idea of just requiring the PhD, will only make sense. And I mean a doctorate degree, because sometimes a PhD is different from ADD. You're just talking about a doctorate degree, period. But that just kind of historically, that was the reason why master degree level people were allowed to be in position, because it was a terminal degree. You didn't need it. The only time you needed was when you were a psychologist. So
Right.
Anyone else? Okay, so do we need to make a recommendation? David, isn't that the point that we're at, is we should look for a recommendation to require?
So there already is a requirement in the regulation. So if there's support for keeping that one the way it is, there doesn't need to be any action.
Okay.
You need to take action if you wanted to change an existing regulation.
Okay, so Does anybody want to make a motion to change the existing regulation? And if not, it'll stay the same, as I understand it. Jim, I just saw you buzz back in. Do you have a question? Okay, we're just good to see you now. Oh, you're on mute. So it doesn't sound like we need to make a recommendation.
No, I'm good. I didn't even know I buzzed out. Sorry.
Okay, that's all right. So we may not need to make a recommendation. If we're leaving it the same and nobody really feels strongly about changing it, then we'll keep it the same. Anybody feel contrary to that? Okay. Thank you so much. Okay, the next one that we will discuss, let me go back to my notes. Core faculty, the ratio between core faculty and adjunct faculty. And again, do we keep it or do we want to talk about it and change it? And so, this one, other disciplines are not really changing that this much. Is that correct, David? I mean, I really don't see other disciplines really. Why are we questioning that ratio?
So the only profession that has recommended a change to it is master's level psychology.
Right, okay.
They indicated that there could be experts that could come in to provide education on a certain topic, and that may be helpful. And so they currently do not have a national accrediting body for master's level psychology. So they don't have a national accrediting body to kind of compare the standards in Kansas to that body. The APA is looking at developing standards for that next year. So should that be something, they might have to reevaluate the change they recommended. But that was kind of their thought process when they were considering it. But everyone else has not made any changes on that area of core faculty versus non-core faculty.
Okay, thank you.
I believe that it's also dictated by KCRAP. KCRAP accreditation would tell us, what percentage of courses can be given by core faculty versus adjuncts. So I think KCRAP already is taking care of that, beyond the law within the state. But I don't, just kind of. And by the way, David, that's the reason why KCRAP is tuning the screws, because the master level psychology is APA gonna take over that, so.
But these requirements are listed outside of KCRAP accreditation. So because we have to allow schools that aren't KCRAP accredited. So the ratio has to be this listed out in the regulation so that we have it the same or however you want it.
And currently it aligns with KCRAP. I like the idea of keeping the ratio tight, mostly core faculty, just because I think it supports, a similar reason to why we want to have a counseling psychologist as the chair of the department or as a head. It helps to build integrity for the education of our students. So, that's just my opinion. I'd like other ideas and opinions.
Well, I like the idea of keeping it the same, having a tight on that. I'm an adjunct professor, but I do believe that universities that, to meet that requirement, it makes universities put money into those programs and create the money for the faculty. And I think it's huge. So.
Thank you for that. Anyone else?
Problem right now is that it's difficult to find faculty members, core faculty members who will fit into those categories. And KCRAP has created that issue and exacerbated that issue because of their detailed qualifications for that. And so you may find that creates a problem for universities to try to hire to meet those and fill those positions. That's just the reality of the situation out there. Whether you're KCRAP or whether you're not KCRAP, that is the reality of the situation. And because If we're looking from outside the state, many people from outside the state do not seem to feel that they can come to Kansas for their for those university responsibilities. It's just it's a hard sell sometimes. So I just want us to keep that in mind from the perspective of the institutions, the universities.
That's a real good point.
That is a-
Thank you, Bob.
Being a former faculty member at Pittsburgh State University in a long-held KCREP program that ended in May of 2017, the university had a lot of financial cutbacks, and one of the things that occurred was our department had a lot of cutbacks, so we could no longer really afford what it cost to maintain KCREP. And we also had retiring faculty members in our KCREP program who were not being replaced. Me being one of them, but also our former chair of our program. So consequently, PSU, after having a well-respected, fully attended KCREP program in counseling, no longer has that. And that's a real loss to the area of Southeast Kansas, because we trained a lot of counselors to fill positions in Southeast Kansas. So that's and it was a lot of it related to budgetary constraints of the university.
It's definitely difficult for the smaller universities to be able to compete with the larger universities for faculty members, all the way from salaries to other issues and locations within the state, et cetera. Those that are not in metropolitan areas find it difficult to entice and retain those faculty members. And it's just a difficult situation. So I'm not sure that we always think about that in terms of what we're putting out as far as the outcomes of our programs, within the state, to make sure that they are quality people to be safe for our population. But I think it's equally as important as other issues to be considered, what quality we have.
I think university administrators also need some help in understanding what it takes to have a program that's going to be training quality mental health professionals.
Agreed.
They really don't get it. It's all numbers.
How would that best be accomplished?
I tried.
Who would be the best voice for that? I mean, I'm really curious what
Yeah, I would like to know that as well.
I think that this is across the board issues, remember when I said that I was coming to Wichita, people thought I was crazy, coming from Richmond, Virginia. And, so I think that there's a challenge to bring, any given scholar to any given university, because most of the administrators are looking for the bottom line. They're not looking for quality. They're looking for, let me see who are bringing the cheapest person to occupy that position. Right? And so I don't think there was a debate for a long time about getting away with tenure. Every 5-7 years, that recycle again, because they don't want to pay, full professors the full salary because, they can hire 2 new out of the school assistant professors to what they pay, professors. So I think that piece is interesting. But and I don't know it's a solution. I think administrators are going to do what they do. Administer, not lead, because they're not leaders, they just administer, and they administer what they give it to them, So I don't know if there's a solution, but I still believe that, keep it this with align with K-Craft, it's in our best interest for the time being. So.
Okay. So does anybody want to make a recommendation to change the standard? And if we don't make a recommendation to change the standard, we'll keep it for now. We can certainly revisit it at another time.
Having listened to the conversation representing the public, I don't see any change coming that will decrease the need for mental health expertise in our communities. That said, with educational institutions perhaps focusing much on the bottom line as opposed to what is needed in the environment, I'm hopeful this board continues to look at this, and it might be needed on an annual basis, I don't know, and be open to the fact that we might need to make changes in order to be sure we have enough mental health professionals to take care of the communities that are not in major metropolitan areas and those techniques. This is a growing problem that any member of the public who watches the news knows is getting worse and not getting better. So I would just, I can't speak to what's required academically or educationally, but I do wish the board to remain attuned to the need and how sometimes we might have to change some of these requirements in the future in order to adequately meet that need. And I'll use the term save lives.
Mm-hmm.
Well, I think that's part of the problem, Jim. And the bottom line is that when we don't meet the requirements of ratio in terms of student faculty, we immediately start to lose, because like my programming here in Wichita State, we love to enter a lot of students, right? But we don't have the faculty, So everything, the supervision, the internship, all the interesting things that start to fall down the side, because we look at the number, we don't look at the quality, And I think that's an issue that is very dear to my heart because, we want to prepare good counselors. We need good counselors. We don't need people just to have numbers, So I think that's the piece, and sometimes this ratio kind of protect. They protect that quality, that standard, that interaction between the faculty and the student to give them quality.
I agree with you. Quality is paramount, but my biggest concern as we go forward is the in-person requirements. If you don't have the faculty, you can't do the in-person requirement, and then you're in a catch-22. And the use of telehealth, the use of these types of mediums,
right,
is going to be a significant change when some point we come to the area that in-person requirements are not possible because we have no qualified people in the southern part of Kansas. That's it. So what do? We'll be forced into a change instead of helping facilitate that change. And maybe in that way we help the universities. How do we find somebody qualified? Well, we have somebody that works remotely for us at the University of Chicago or whatever the best institutions are, where these people want to live as opposed to how they can help us train and educate. So David, I hope I can speak to the in-person requirement again, because I know last time I was speaking out of turn, but the in-person requirement is going to present a challenge.
Which is why we saved it to last.
Being a practicum and internship supervisor, and I know how much time it takes to work with those students and how many things come up as they're dealing with their learnings and experiences in their practicum and internship sites, working with the site supervisors, working with the students. And maybe I have 6 interns that I'm working with, but the university doesn't look at that as how much time goes into that. It's like, we only have 6 students, it's like, well, I probably would spend half my time, dealing with things that come up and meeting with them and sometimes holding their hands through, the interns' crises in their learning and experiences. So it's that in-person piece is so critical to the quality of training that we provide for the next generation of mental health professionals.
I understand that, but when it's not possible, how will we adapt?
I know.
So it sounds like, to go back to the second item, core faculty versus adjunct ratio, it sounds like we're not making any move to change it today. I understand that to be correct? Okay. I will make sure that it is an ongoing discussion. I like the idea of revisiting it because things do continue to change. So we already naturally moved into the remote requirement, or the in-person requirement. So let's go ahead and discuss that more and see if we can figure out a way to move forward with it. And if not, it can also, of course, be an ongoing discussion. But any ideas or feedback? Let's keep going with that.
Well, and I'll just frame this real quick.
Yeah.
So under 102-3-3A, in
Mhm.
terms of the in-residence item, under B, it talks about at the time of application, each applicant shall have fulfilled the following requirements. Either one, received a master's or doctoral degree in counseling from a program that meets one of the following requirements, is not below the accreditation standards of KCREP, or meets the requirements in subsections F and G. And if you look under section F, these are for the people who did not attend the program that's KCREP accredited. Under F, you have to have your educational program meet the following requirements. Under number 11, it says it's required that at least 30 graduate semester hours or the academic equivalent of coursework be completed in residence at one institution, and require the practicum or internship be completed at the same institution. And the current definition of in residence can be found on the front of 102-3-3A under A1C2, I believe. But it's A1-2, I guess, the definition of in residence. And it currently says, when used to describe a student, it means the student is present at the physical location of the institution for the purpose of completing coursework during which the student and one or more core faculty members are in face-to-face contact. So there's a lot there in the in-residence definition. It talks about being physically present at the institution for the purpose of completing coursework during which the student and one or more core faculty members are in face-to-face contact. There's different ways to approach the in-residence requirement, but if you wanted to just look at it from the perspective of removing the physical location requirement, one way to do that potentially would be to change the definition so it would say, in residence, when used to describe a student, means that the student is completing coursework during which the student and one or more core faculty members are in face-to-face contact. And for online programs, I think a change like that would still keep the face-to-face contact, but it would need to be over a screen. It wouldn't change the other requirements as far as it being in front of core faculty members, but it would remove a reference to being at the physical location of the institution as part of that in-residence definition. So I'll open up the discussion, but just wanted to highlight that as a potential change if you wanted to just focus on the physical presence requirement at the school.
And to add that KCREP does have online programs. KCREP doesn't require 30 semester hours in residence.
And in
Yeah,
talking,
in looking back at the history of it, it looks like there was a change at some point from 12 hours to 30 hours.
Yes.
Graduate semesters. I'm not sure why that occurred, but it's kind of like, okay, you're basically saying no online courses, essentially, is what you're trying to do. And that's not the world that we live in these days.
well, and I can tell you all from talking to different states at different association meetings at the national level, when I talk about our physical presence requirement, the in-residence requirement, I have not found another state that has a similar requirement like that to us. So we are a bit of the outlier, at least in terms of professional counseling. Now, when it comes to psychology, that's kind of a different subject, but at least in terms of professional counseling, I haven't found another state that has a similar in-residence requirement that requires physical presence at the school.
my opinion would be that my online classes versus my on-campus classes in my program, I learned so much more, I thought, on campus. And I just got done teaching skills, and every one of my students in their reflection said being on campus was a real game changer. They felt a lot more competent now to go out and do those things. I don't think, while I think that is the norm, I think that realistically we have to look at, one summer I taught it and a gal broke her leg right before she came, and she ended up having to drive out instead of fly because of all the cumbersome from Washington State. And so like, I do think that there are certain circumstances that if we could allow somebody to come in by Zoom, it makes more sense. And I think they'd learn probably and be just as good of a therapist.
Teaching, having taught both online and in-person classes and on Zoom classes, the reality is that there's only a couple of classes in my perspective that really need to be in person. And those are the helping relationship skills kinds of classes, techniques kinds of classes, and a practicum class, perhaps. Those that are hands-on, specifically hands-on. So I'm not sure where they came up with this, 30 graduate semester credit hours, but it's like in today's day and age, that's not realistic for universities. It's just not.
Right.
I would agree with that too. Where I'm biased, I like to have face-to-face.
Yeah.
I like to do my little song and dance and jump around, and move from one place to the other. And I cannot do that when I'm online. I also know that the COVID taught us something. COVID taught us that, I teach a stats class. I don't need to be face-to-face with you. I teach an assessment class. I don't need to be face-to-face with you. I like to teach my multicultural class face-to-face because I'm very established and I look at behavior. And behavior will tell me where you're at. But again, I don't think why we have to be so rigid given the lesson that we just learned. In which there's some things that we can, even the whole idea in here that we have choice in rural areas of counselors, that telenet thing is a hit, we only need to get Medicaid and we'll be good to go, but I think that flexibility should be part of what we need to be talking about and reflecting on.
Yeah, agreed.
Just to put this out there, because other professions, psychology and master's level psychology have in residency requirements, but it's for specific courses. It doesn't have to be half of the coursework. It could be skills-based coursework. And it could be face-to-face for all, however many skill-based courses you want them to have.
That's a good point.
I don't know how you would write that in the
Right.
write it, however, but I understand what you're saying.
I think we could bring to a later meeting, we could bring the addictions, has it spelled out differently, and so does psychology, to kind of show you what they look like.
I like that idea, to be able to look at those. Would you be willing to send those to us before our next meeting?
Sure.
Okay, so we can go ahead and look at that and see if we can be creative, for lack of a better term.
And we have the LMLP one is currently being changed to change the core faculty. So that won't be in what I send you, but it has been amended to take out that it all has to be core faculty.
Okay. So do we want to look at that also?
Is that okay, Dave? Can I mark that up and highlight it and send it to him?
Sure, it'll be fine.
I see some head nods, so would you please?
Sure.
Thank you. Thank you, of course. Making Leslie do all the work as usual.
That's what I'm here for.
I know, but you're very good about it. Thank you. Okay, so thank you for that. So we'll go ahead and discuss this at our October meeting. And that'll give us a chance to look at it and get a little bit creative about how we can work with the in-residency requirement. Okay. We have new business. It looks like we're going to need to skip new advisory committee members out of time. David, are you okay with us moving that to the October meeting?
Yeah, that's fine.
Okay. So an update, we would like an update from the Subcommittee on Unprofessional Conduct Regulation Review. Does anybody want to provide an update?
I can give a short update on that. So the Subcommittee on Unprofessional Conduct Review met on July 18th and went through the first half of the unprofessional conduct regulations, noting some possible changes and recommendations. They went through the first 27 items in the unprofessional conduct regulation. And there will be a follow-up meeting, and that will be at noon on September 15th.
Great, terrific. Thank you so much. And the last thing we'll do before we'll ask for a wrap up is to talk about the licensed psychology regulation KAR 102-1-1-15. And really the flexibility of it is what that's about, the flexibility of that regulation. So can you frame that for us, David?
Sure. So this is the only profession that has this regulation, but I'll go ahead and I'll share my screen just for a second here. Okay, so this comes from the psychology regulation on continuing education, KAR 102-1-15G. And what this regulation says is it says any applicant who submits continuing education documentation that fails to meet the required 50 continuing education hours may request an extension from the board. The request shall include the applicant's reason for requesting an extension and a plan outlining the manner for which the applicant intends to complete the continuing education requirements. For good cause shown, the applicant may be granted an extension which shall not exceed 6 months. And so, as I mentioned, only the licensed psychology profession has this. But when they had all of their licensees come up for renewal, there were a number who had not renewed about a week before the deadline. And so we used this regulation and sent a message to anyone who hadn't renewed yet saying, if the reason you're not renewing is because something happened that prevented you from finishing your hours and you had good cause for needing an extension, I want to let you know about this regulation. If you believe that you would qualify under this, go ahead and submit a proposal to see if we can get an approval. And then what they were able to do is, if approved, they were able to go ahead and renew their license and then get up to 6 months additional time to finish their continuing education hours for the current license period. And with SIPAC and a number of other factors, we were concerned about our licensed psychologist licensees going down. And we were able to use this to help about 10 licensees continue to renew their license and provide services. And some of them specifically said that they were basically considering retirement or stepping away from the profession. And by being able to do this, they were able to keep practicing. So what I want to do is propose it to your advisory committee to see if you think language like this would be helpful for professional counselors, potentially because of something that came up related to the pandemic, or an unusual health situation, or perhaps something that involved a family member or their health, something that basically interfered with their ability to finish their continuing education hours when they normally would prior to renewal. They would still need to submit a proposal for finishing those hours and have to show good cause for needing the extension, but it could allow additional individuals who are currently licensed to stay licensed under the BSRB. So I wanted to open up for you to discuss this and see if you would like something like this recommended be added to your regulations on continuing education.
So I have a question. On the 10 that you mentioned for licensed psychologists, you sent out, you notified them, hey, there's this, law we can use that allows you to license, and then they applied for that. They applied for that exception?
Yes, in the past, the BSRB had approved these if individuals specifically contacted us noted the regulation and asked for consideration. So then we reviewed the factors and then approved certain individuals that would qualify. This time around, we decided to take a more proactive approach, and we sent it out to all individuals who hadn't renewed to say, if you believe you might qualify under this and you wish to continue practicing, let us know and submit a proposal of why you need a good faith grant of an extension for good cause, and then a plan to complete your hours. So that's what we did for the licensed psychology profession, and it was successful. So we wanted to open it up and see if other professions wanted this too.
Terrific. How long was that process when they responded and asked for the exception?
It was a real quick turnaround. I believe we sent it, and most of the individuals responded back with the necessary information probably within about 2 days. And
Right.
most of them were very clear cases. Most of them involved the pandemic directly, so they were easy to review and approve. Now it's a little easier with licensed psychology because they all renew at the same time. But I believe we could set up a system to track these. And then what we would do is we would follow up with people if they hadn't provided the information to us in 5 months, and to let them to see if they've completed their hours. And then if for some reason they shouldn't complete the hours in 6 months, then we would file a RAV, or report of alleged violation, for them not completing their hours. So there would be some accountability for it, but it would also provide a little bit of leeway to allow us to keep people licensed.
I like that idea, because then again, it sets up accountability. Then is this person, you're making sure this person isn't breaking the rule. Okay, thank you for answering that. Any other questions?
I like it. I like it. Even the idea of just kind of send the reminding and say, hey, you have an issue, during COVID, there was a whole bunch of issues. Many of them were money-like, okay? So at least I give the person the opportunity to kind of, get 6 months to at least trying to complete as much as possible, so it's not a freebie, it's just, we understand.
Mhm.
Yeah, and
I like it. I'm not sure that we need 6 months. That is an awfully long time. But I'm not opposed to the idea of it, no.
one thing too, we had to clarify is that we're not extending someone's license. They don't
Right.
get time to practice for free. We're just making sure they can continue to renew their license. And so they all have to renew once they're approved. And so that way they stay licensed.
Terrific. Any other feedback about that? So at this point, it doesn't seem like we need a motion. We would ask for the rule or the exception to be written for us, and then we could adopt it once we take a look at it. Is that correct?
We could do that way.
Okay. Does that seem like the right way to do it? Because we don't really know exactly what we do, but we really don't have specific language we're voting on because it's not adapted to counselors yet.
It would be a little different based on the number of hours, but we could just take a version of it and bring it back for counseling.
Okay, so we'll do that in October. Okay. Okay, thank you for that. Thanks for your feedback, everyone. So we'll look at new advisory committee members next time. We have a great group to choose from, and so we'll need to do that next time. Anybody?
How many will we need to choose?
I think our number just changed because someone rolled off the advisory committee. So we were thinking about 3, weren't we, David? And now maybe 4?
Right. So according to the advisory committee policy, non-board members, there should be a minimum of 3 and a maximum of 10. And so currently right now, with Jessica Allison dropping off the advisory committee, there are 5 non-board members in the advisory committee. So you could add as many as 5, but to make sure you have staggering, I would say 3 or 4 might be a good number to shoot for.
Anybody have an opinion about 3 or 4?
I'd like to get 4 just in case.
Just in case. Yeah, we just lost somebody.
Yeah.
And I like more voices anyway. I think the more the better. So, everybody okay with 4?
Could we add 3 this year and add 2 next year?
We will probably do that anyway. I mean, yeah, the 4, I don't know what attrition is going to look like in the next year, but even if we added 4, we'll most likely have room to add 2 next year.
And as far as current members, there are 2 members that would come up at the end of their 3rd term at the end of June of 2023, but nobody is close to approaching the end of their 4th term.
So no one's rolling off. Okay. Okay. So we wouldn't necessarily add somebody next year if we did 4, which I think really is fine. I mean, we don't have to add new people every year, but you know, the year after that, we would be adding 2. Any other opinions? I vote more for 4, just because again, somebody, you know, there will probably be some attrition, and next year we'll have room to add 2 people. Or no, the year after that. That's right.
And just as a reminder, in terms of the review of the candidates and discussion, one thing that's helped a lot of the advisory committees is to come into those meetings ready to talk about the top few candidates that impressed you the most. And then if there's consensus among the members, that could be a good way to identify the ones that you might recommend be added to the committee. So,
Okay. So is it okay if we do 4? Can we start for 4 and see if we find 4 people?
I think it's important too to take a look at the geographical areas that we have covered and that we don't have covered maybe. The Kansas Counseling Association splits up the state of Kansas into 6 different sections. And if we use those kind of criteria of where the divisions are, we really don't have anyone from Southwest Kansas. And currently we don't really have anyone from the North Central area.
Right.
We have the other areas covered, represented, but those are 2 areas that we don't.
and if you all want to see the current geographic location of the current board members, if you go to the BSRB website under the advisory committee page, you can see the list of the current advisory committee members, and next to that you see their city or their location. So you can check that for the current members too.
Thank you for that. So be thinking about Southwest and North Central. And then how does the Kansas City, like the Overland Park area, how does that all look? There's just me. Is there anybody else? Wait, no.
I think there's several in the Northeast area. I think there's like 3 in the
Well,
Northeast
now we have
area.
Jen too.
Yeah.
Right. So we're good here. Okay, good. Okay.
If you go by population, there's more population in the Northeast area than there is in the other areas, and then the South Central, which is like Wichita area. But if you're talking about total geographic kind of equivalence, the 2 areas that really aren't represented are Southwest and North Central kind
Okay,
of
good.
areas.
We'll focus there. Okay, terrific. So we will come back with in mind of hoping to select 4 people, and we'll focus on the Southwest and North Central area and then other diverse considerations. Anything else about that? Okay. Well, thank you for your time and all your thoughts and ideas. And now I just need a motion to adjourn.
I move. I'm talking a lot today.
Okay. So Adil makes a motion to adjourn. I need a second.
Second, this is Bob.
Got a lot of seconds. Bob seconded, I heard. Okay, all in favor, say aye.
Aye.
I doubt I'll hear any nays, but I have to ask. Any nays? Okay, so moved. So we will adjourn. Thank you so much, everyone, for your time, and we'll see you in October.
Thank you, everyone.
Bye, everybody.
Thank you.